Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Hello, everyone, and thank you for joining us for another extraordinary Action on Pain podcast. I'm Virginia McIntyre, joining from Nova Scotia, and today I'm again joined with my talented co-hosts, Keith Meldrum and Jennifer Daly-Sear. We have a delightful guest today, and I had the opportunity to do a sneak peek on her bio and a few things about her. And this will be the first opportunity I'll get to meet her. So I am thrilled to be here and an opportunity to meet this guest today and have a discussion.
Great. Thanks, Virginia. I'm Keith Meldrum. And for those who listen to us regularly, first of all, we thank you for that. And who might be new, I'm the West Coast representative of this little trio. I'm out in Kelowna, British Columbia. Always a joy to be here with Jen and Virginia. And like you said, Virginia, I'm really looking forward to today's guest. I've also read about her extensively. And Jen will introduce her, but the profession she is one that I am very respectful of and think very highly of. So I'm really glad she's been able to join us today.
Awesome. And of course, I'm Jennifer Daly-Sear, and I'm joining the conversation today from Ottawa. It's really great to be back in studio today. We'll be talking about the role of nurses in Canada with respect to pain and how this aligns with the Action Plan for Pain in Canada. We're really excited to welcome Dr. Kimberly LeBlanc to our show. Dr. LeBlanc is known globally as an innovative nurse leader. She is the current academic chair of the Association for Nurses Specialized in Wound Ostomy and Continence Canada's Wound Ostomy and Continence Institute, and an advanced practice and certified wound ostomy and continence nurse working with the aging population. Kim is the current president of the Canadian Nurses Association, CNA. She holds a doctorate of philosophy and nursing from Queen's University. Without further ado, Dr. LeBlanc, thank you so much for joining us today.
Well, thank you all so much for having me today. I'm joining you today from the unceded territory of the Algonquin Anishinaabe peoples, also known as Ottawa. It's a brisk day today here in Ottawa, but I'm so happy that you've asked me to join you today.
Thank you.
It's great. We're so glad you can be with us today. So there's a lot to unpack here in this conversation, we know. And so we're just going to start it off with the first question because we're very interested to just have a really meaningful conversation with you. So chronic pain is a significant public health issue in Canada. I think most of us would agree with that, as it affects at least 1 in 5 Canadians, probably more when you consider other conditions like migraines, low back pain, and women's public health. Among us, we think it's probably an underreported chronic condition. For those who live with, the personal experiences of pain, and that's my colleagues here, nurses play an integral role in increasing access to evidence-based pain care. So with that, and when we look at the action plan, that really speaks to goal 3, which is about education. And we were just wondering if you could talk a little bit about the work that you do and sort of how it, relates to education and just your role overall in chronic pain for people.
That's a really great question. A lot to unpack there. So as Jennifer had noted at the beginning, I'm currently the president of the Canadian Nurses Association, and we're really the national voice for Canada's 500,000 nurses in Canada, looking at all categories of nursing. So in my role, working as advanced nursing leadership, really what we're looking to do is ensuring that all Canadians have equitable access to a nurse and that they're receiving evidence-informed care. So we represent the nursing profession. So we're not unions. They represent the workforce. We're not academics. We don't teach the nurses. But what we do is try to advocate for nursing and the roles that we play. So when we take that and we try to link that to the goals of your group, what we look for is ensuring that allowing nurses to all work to our full scope of practice. So really what that does is allows us to be able to work with people in regards to pain by having us work to our full scope. The equity and cultural safety piece. So part of our federal action plan through the CNA is to really address inequities, in part in pain care, particularly among our Indigenous populations or marginalized communities. And this folds through to our next priority, which is strengthening primary care. We know that most pain management happens in the primary care setting. So there's such a deep connection between primary and community care and pain management. And this is where nurses can play a huge role in looking at these integrated team-based models of care. And this leads into having these evidence-informed. So, certainly we met with a lot of parliamentarians just a couple of weeks ago when we had our Hill Day. And during that time, we really talked about inequities in care. And maybe in part just because I knew this podcast was coming up, but we did talk about using pain management as one of the indicators when we're looking in primary care of where as Canadian healthcare professionals we can do better. So I think that, there's a lot of work to be done. It is a priority for nurses, and I think that sometimes the conversation gets left off. When I talk to a lot of my patients, because I still maintain a busy clinical practice, is that often people will talk about not feeling like their pain concerns are being taken seriously.
Yeah. And I think that speaks to a bit of a follow-up question there. And you've touched on it, what are one of the challenges that you see in this? And right there, you've just mentioned, nurses are front and center with patients, people who live with pain all day long. I know in my experiences in the numerous hospital visits, I saw nurses every day, 4 or 5 times a day. I saw the doctor maybe once a day. So, who am I going to connect with? So that challenge of not being heard and that interaction with nurses, how do you see that role, the role of nursing in that, being able to lift that up, to make that a priority for people? Because as you say, it happens too often.
Well, one of the cornerstones of nurses is that we are nursing, is that we see ourselves as patients' voices. So when you don't have a voice, we're your voice for you, that we're going to advocate for you, that we're there to listen to you, to validate what you're saying, and to hopefully be able to take that forward to the integrated team. This nurses have taken a huge leadership in the pain role. Are we always perfect? No, we strive to be, but there are times when we fall short. So I think, part of our role as nurses is to really listen to our patients. And the problem with pain, as the three of you know better than I do, it's not something that you can hold on to. It's not something that, there's a blood test for that. There's not an x-ray for that, right? It's a very abstract kind of notion. And pain differs from individual. We could all be sitting here with the exact same diagnosis, and we're all going to experience that pain differently.
Such a great point.
Yeah.
I remember starting nursing, and I hate to admit over 30 years ago, but being told by a professor, always remember, pain is what your patient says it is.
Wow. Nice.
Right?
Yeah.
And that's something that's followed me through my whole career, that everybody's pain is individual, and how you experience it is going to be different, and how it's going to manifest is going to be different. So I think as nurses, that's one of the most important things that, we have to make sure is out there, and that our patients understand that when we're coming to you and you're complaining of pain, perhaps some of the questions we ask you may seem intrusive or they don't believe me, but part of it is us trying to unpack what kind of pain you're experiencing and how can we best address it? Because medication isn't always the answer. Other things that we can do, it depends on the type of pain you're having. Is it episodical? Is it situational? Is it chronic? There's so many different components, and you can experience 4 or 5 different types of pain all at the same time.
Kim, I find it's quite amazing. As I come through a family of healthcare providers, I'm in diagnostic imaging. I have a daughter who's a manager in nursing. My mom was a nurse. And I like that, how you listen and validate to the patient and move the voice forward. How do we keep nurses and close that gap that everybody is, especially our nurses, they are really one of our first people we contact with about chronic pain? Because I think in almost anything that you specialize in as a nurse, whether it's oncology or obstetrics or whatever, or merge, you're going to come across patients who live with chronic pain. So how do we keep them really at the forefront about what chronic pain is and the importance that, like you said, their pain is what they say it is?
Mhm.
Because I mean, we know that clinicians, some doctors have limited education on chronic pain. What about the nurses?
Mm-hmm.
So our education as nurses can really vary from what kind of nurse you are and where you've done your education and where your own areas of specialty are. So one of the things that I think is really important as patient advocates is that you keep a good line of communication with the educational programs so that you start at that foundation and keep the pressure on so that nurses receive that education from a foundational level up. So the Canadian Association of Schools of Nursing, also known as CASN, that's a body that works with all the educational programs across the country. And part of that is looking at continuity of care. They share ideas. And these are good places that you can start to make sure that nurses are getting that equal education as well around pain. I happen to have had a professor that was her area of interest was pain research. So for me, it flowed naturally. She wove it into everything. I can't say with certainty that every other nurse has had the same background and foundation that I had back when I was a baby nurse. What we can do in work environments, and this is something that I think I can challenge all nurses to do, is when you're out and you're working with individuals who are experiencing and living chronic pain, is to try and always keep that open mind and that open lens. And that if this person is saying they're having pain, they're having pain. And, it's a matter of addressing it and trying to figure out, as I said, how can we best address it? And sometimes there is no magic pill. Sometimes there is no medication that's going to help, but there's other things that we can do. For me, I think pain is an equity issue. I think the four of us sitting on this call are coming from a place of privilege.
Mm-hmm.
We have white privilege.
Yeah.
And in my day-to-day practice, I do see how sometimes if people from different backgrounds, their pain is addressed differently. And I think we have an obligation to make sure that all people are treated equally, especially when it comes to pain management. And, individuals who use drugs, persons who PWD, persons who use drugs is a politically correct term.
Okay.
Mm-hmm.
They don't come to us for their drug addiction issues. They come to us for pain or whatever ailment they're having. And if they don't ask us to intervene with their drug use, we're not experts in that. What we have to look at is they're coming and they're in pain right now, and they may need more pain medication than the average person or a different type of pain medication. So, that's just one example where we don't have equity, where often we do judge as a society, and we have to overcome those barriers so that we can provide better care for our patients.
And on that note, as you were saying earlier, Kim, in terms of I love how you've very clearly outlined the important key role of like that nursing staff when you first encounter nursing. And I think hearing all the possibilities in terms of how they can continue to increase and improve their education, what their eye generally on the ball of, how can I make it better for this individual? I mean, that's certainly been my experience with absolutely every nurse I've interacted with in terms of that caring and compassion. What would you recommend for individuals like us, like people living with pain, to remind them or to help coach them in terms of how they can interact, what the importance of that role, to remember that before they see the doctor, for example? Does that?
Yeah. So if I'm understanding your question correctly, I think that one of the things that you can do is understand that as frustrating as it is, you may have to repeat your story again and again and again because healthcare professionals are only human. And the documentation that they have on you may not give a clear picture. So if we're asking those questions time and time again, it's so we can get a clearer picture. You may or may not be aware, but in the last couple of weeks, there's been a big spotlight on violence in the workplace.
Yes.
And often when I've experienced violence personally in the workplace, it's come down to someone who's in pain, who's lashing out. So just to remember that it's never an excuse to lash out at healthcare professionals and understand that we are there trying to provide the best care we can. And pain is such a complex issue. There's so much to unpack that we may ask you the same questions again and again. So I just ask to have patience. It really helps for me when a patient comes and has their story written down for me. So, look, here's, I'm not talking a novel, but just having their story. So in my practice with individuals who suffer from chronic wounds, along with that is chronic pain. And they'll also have episodical pain. Like when I'm changing the dressing, that's an episodical pain. It's a sudden thing. It's an acute pain and it will go away when I'm finished the dressing. But then there's a chronic baseline of pain that's always there. So when I have someone come to me saying, look, this leg ulcer has given me chronic pain, and these are the issues I'm having with it, but they also tell me this is what's been tried in the past. This is what's worked or not worked for me. And these are the things that nursing has done that's helped me, and these are the medications that's helped me. For me, it gives me some tools that I can then go and advocate on your behalf. And I can try to put together a plan moving forward. And I can make sure that documentation goes into your record so that maybe you won't be asked the same questions over and over again. But I can also work with the team of nurses that I work with to ensure that, okay, say, Jennifer, you have a chronic leg ulcer. Well, it works really well if we put certain types of dressings on you and we medicate you 45 minutes before rather than the standard 20 minutes. We're going to give you, and if we play music in the room and we make sure that the lighting is low or different things that have worked for you, then we can certainly come up with a care plan we may not remove the pain, but at least we can minimize it and maybe give you some control back as well.
I love that. I love how individualistic you've just painted that picture, and also how, because one of the things we often talk about amongst ourselves or with others is like looking at the whole person, not just the symptoms, right? And that's what you've just described. And in a way that's completely, really very impactful in terms of my understanding of it. And also about bringing your own story like that. That's something that I don't know if people are necessarily aware that they should be doing that. So I think that's great advice, in terms of helping with that picture.
I think we have to look at it as a team approach, right? Healthcare is a team approach. And if you ever attend, any nursing lectures, you'll see them talk about the team approach, and that the center of the team is actually the individual. So it's not, and then all around you'll see this, or diagram. It's always the individual and their family in the center, and then all around it we have the healthcare providers, whoever they may be. So it's really important. And, your algorithm is great in terms of, in wound care, we always say, look at the whole person, not the hole in the person.
Oh.
So
I love that.
I love that. That's great. That's great. And, on that, am I correct in thinking that when it comes to wound care that you're often dealing with, it was mentioned in your bio in terms of older age population. And with that, could there also be some proportion of them that would be suffering from maybe dementia or things like that may not allow them to be able to express? So how do you manage a situation like that?
So, wound care knows no ages and no boundaries. So we see it across the lifespan. I do specialize working in the aging population. So with my population, we see this intersection between wounds and dementia. And what we'll see is some forms of dementia, and we've hypothesized that it's the medications they take, can actually lead to wounds in some cases. And in other cases, we see where the wound care, like if they have a wound, it can actually increase the dementia symptoms. So particularly aggressive behavior. So I'll often work with the staff and say, if you have someone who has dementia and they're not normally aggressive, and they have a wound and they start being aggressive, these are signs that they're having pain. They may have an infection. So let's look at that. So we definitely see dementia worsen, and there's symptoms of dementia worsen with wounds and wound pain. But as I said, in some instances, some of the medications that people take can put them at higher risk for developing or a wound not healing. So there is this intersection that we see between aging and wounds. But you can take that and put that to all kinds of other things as well. If someone is in pain, I often tell people, think about your toddler who can't necessarily express they'll throw a temper tantrum, right? If they're in pain or they're upset about something.
Mm-hmm.
Well, we see the same in an older individual who has dementia. They need to express some way that they're having pain, and they may lock down. They may stop eating. They may start acting out, having aggressive behavior. There's so many different ways it can manifest itself. So as healthcare providers, it's really important that we not only understand, that's why you look at the whole person. So it's not just, this type of wound has pain, because everybody experiences it differently, but how is it affecting that person?
Fascinating.
I just love that. And I go back to the action plan and we talk about goal 3 in education. What I love, and this just supports what Jen just said a moment ago. So forgive me as I repeat myself. You've taken the broader goal of education, sort of that foundational education. You talk about part of what you're doing is looking sort of pan-Canadian about getting, education consistent across, nursing schools. You give that foundational education. So then the nurses have that, they're empowered with that education to be able to look at the individual. So if they understand the underlying driving factors, then they can say, how does that apply to this person, whether it's their age or their socioeconomic status or all those things. And I think that's missing overall in healthcare, definitely in pain. But, I just love the fact that your organization, you're taking that on to make it, as Jen said, person-centered.
Fabulous.
Certainly, this is the foundation of nursing, and this, to bring it back to the Canadian Nurses Association, as an association, we are looking at promoting nursing, but also promoting health of Canadians. So we believe that by having healthy, happy nurses, you're going to have healthy, happy Canadians. But part of that is, as nurses, we have the responsibility to ensure that we do look at the whole person, and that we do really look to make sure that we're providing equitable care and that we're not leaving anybody behind. And pain has been one of those factors that people don't understand. And when they don't understand it, they tend to push it to the side or come up with excuses for it. And I think, the three of you working on this, with this action group, that you fully understand the concept that pain is so individualized and so complex, but we are doing it in justice. I'm happy to see more and more research is being done, but not enough.
Right. Yeah.
Thank you, Kim. I think that kind of brings us near the end of it, but I think it brings some really important words about patient-centered. We need more research. We're not doing pain justice. Yeah. And I think these are very important points kind of to tie things up. And this has been wonderful. And I could see this conversation absolutely going on forever.
Yes.
So it's been a pleasure with you just sharing your time and expertise with us.
And I have to say, it gives me such hope in the future of pain, as you've described it today, Kim. Overall, my experience personally has been fantastic with nurses, and even for myself, for my parents' care. And it's just beautiful to hear how you've described it and just how critical this role is. Thank you for that.
Well, thank you all so much for having me today. It's just been a pleasure, and keep up this amazing work that you're doing.
Thank you. Thank you.
Thank you.
And we'd like to thank all of our listeners for tuning into the Action Plan on Pain podcast. We hope this episode has shed some light on the important work being done in Canada, as guided by Health Canada's and Action Plan for Pain in Canada. Until next time. Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.